Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Intermittent fasting is something that everyone wants to do now to lose weight. But does intermittent fasting affect fertility? Is the topic for today. IF or intermittent fasting is an eating pattern that cycles between periods of fasting and eating. While it has gained popularity for its potential health benefits, its effect on fertility can be complex and vary depending on the individuals and specifics of the fasting regime. So let's look at how intermittent fasting might affect fertility, and we'll do it in depth. So we'll first begin with the potential positive effects. We'll look at weight loss and hormonal balance. Intermittent fasting can lead to weight loss, which may improve fertility in individuals with obesity or polycystic ovary syndrome. Excess body weight can disrupt hormonal balance, leading to irregular menstrual cycles and ovulation. And weight loss can help normalize these hormonal levels, improving ovulatory function. It can also improve insulin sensitivity. Enhanced insulin sensitivity can be beneficial, particularly for women with PCOS. Insulin resistance is common in PCOS and can increase hormonal imbalances. So intermittent fasting, IF as I will be referring to it from now, can improve insulin sensitivity, potentially leading to more regular ovulation and improved fertility. IF can also bring down inflammation. Lower levels of systemic inflammation can support reproductive health. Chronic inflammation is associated with various fertility issues, and IF has been shown to reduce markers of inflammation, which could create a more favorable environment for conception. We also have to, however, talk about the potential negative effects. We have to discuss the nutrient deficiencies associated with intermittent fasting. Restrictive eating patterns may lead to insufficient intake of essential nutrients. Adequate nutrition is very crucial for reproductive health, and deficiencies in vitamins and minerals such as folic acid, iron, zinc can impair fertility. It can also cause hormonal disruptions. Prolonged fasting or extreme calorie intake can disrupt hormonal balance. Women are particularly sensitive to energy balance, and severe calorie restriction can lead to reduced levels of gonadotropin releasing hormone called as GnRH, luteinizing hormone or follicle stimulating hormone, which can potentially lead to anovulation or amenorrhea. There is a stress response also. Fasting can be a physical stressor, triggering the release of stress hormones like cortisol, and elevated cortisol levels can interfere with reproductive hormone axis, potentially disrupting menstrual cycles and reducing fertility. What's very important to understand is that the hypothalamus in the brain does not recognize the kind of stress that the body is going through. Is it wantonly because of intermittent fasting, or is there severe drought and starvation, which is when it will switch off the body's function and will not release eggs or not cause ovulation, and it will bring back good times for the body when proper nutrition is available. So when you are doing intermittent fasting, the hypothalamus doesn't know that this is something that you are doing out of your own free will, and it may cause disruptions in ovulation and menstrual cycles. If you wish to understand more about this, please feel free to call us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.